Hi guys, it's Yolanda from Saying It Their Way. I'm back today for a product review that I really wish I didn't have to do. This product review is based off of one of my son's health. My oldest son, Romy, always had ear infections, and he's had two tube surgeries where they had placed tubes in his ears. He had his adenoids removed, and he's just been kind of prone to ear infections and just health issues. And my youngest son never had really any issues until this school year. He is in kindergarten, and he had never been to pre-K, nor had he been to any form of child care. And he is getting sick left and right. When I say he's probably gotten sick at least once a month, and this past weekend was no exception. Last week he complained of his throat hurting, and he had a mild fever at like 100.2, so really a mild fever. But I took him to the doctor anyway to try to catch anything that may be coming on, because he's even had a bout of pneumonia this year. So I'm pretty on top of it. And they said, his lymph nodes were swollen, so he had a viral infection coming on. And for me to just watch him, monitor him, and make sure he's drinking and eating well, so getting plenty of fluids. And so Saturday he comes, he's like, "Mom, my ear hurts." And I'm like, "Okay." And by the end of that day, by that night, he was screaming blood and murder, like his ears were hurting so bad. And I assumed that it was more so pressure that's causing his ears to hurt, because when he gets congested, he always says his ears hurt. So in addition to treating his ears, giving him pain pills, we also gave him a decongestant to relieve whatever pain was transferring to his ear. But then again, like I said, I assumed, that was my assumption. I'm gonna enter a picture right here to show you how sad me and the baby were this past weekend. Right after I took that picture, the hubby and I decided that we would make a purchase that we probably could have made years ago, and that's the product I'm going to be reviewing today. This product is from Dr. Mom, and it's an otoscope. And I went right on Amazon. It's now Monday, so Saturday night I went on Amazon. Of course, we have Prime. And 2 days later, we now have this. This guy, you're going to see him on film in a little bit, but he's feeling a lot better with the remedies that we did do. I'm not a doctor, so I'm not going to tell you exactly what we did, but we did do some more like a DIY drops for his ears, and he's feeling a whole lot better. But I wanted to have something like this just in case, so I can monitor their ears, because sometimes, we constantly taking them to the doctor, and I don't want to give them antibiotics all the time. He's had at least 5 rounds of antibiotics this year. Well, not this year, in the past 7 months. And I didn't want to go to the doctor and then give him another round. So as long as we're able to manage his pain within 48 hours, then I prefer not to take him. But that's neither here nor there. So today I'm going to be doing my first impression of this. Again, it's an otoscope for home, and it's created by Dr. Mom. And the first thing you see up here is catch ear infections early. So that's the thing I wanted to be able to do, is to be able to catch an ear infection, make sure it doesn't get to the point to where several times I had my oldest son ears actually ruptured. Although it gives him relief, you still don't want their eardrums to rupture, because it may create a bigger problem, including their hearing. Off the bat, I see back here it comes with 2 batteries. So that's great. I don't have to go buy batteries. And it shows you what the inside of the ear should look like. The normal ear, an ear infection, perforation, and it has ear tubes. Like my oldest son had two sets of ear tubes, but they've fallen out, so I won't be looking for ear tubes. And so I'm gonna go ahead and open it. Let's see how it works. So basically the directions suggest or encourage you to test this out on adults first, like so you can get used to using it. So I would advise that you do that. Today I'm just going to go ahead and look at my little guy's ears. My husband's at work and I just wanted to have the comfort of knowing that he's, although you know he is walking around fine, as you will see, just want the comfort of knowing that his ears aren't infected. So I will be gentle. It recommends that you go no further than a half an inch in, and usually 1/4 of an inch in is good enough. They do recommend that you tug on the ear and pull back in order to see through down through the canal. I've been to so many doctor's appointments and saw and looked through these otoscopes there with the doctor with my sons. So I do feel comfortable going ahead and proceeding with this. It actually comes with two, there's one already on it. It comes with 3 of these things that you can put into the ear. The largest one is for an adult. The medium size obviously will be a child, and the smallest will be for an infant. They said with the adults, start with the largest one, work your way down. And if you're testing a child, start with the smallest one, work your way up if it works for them, to see which one works best for them. So I'm gonna go ahead and install the batteries and call my son and try it out.
Ready?
Yep.
Check my throat.
Check your ear. Okay, so turn this way. As you can see, I put the smallest tip on because he is 5, and we're gonna see if this works for him. It does come with a light. At the bottom it has a push thing. And you see, or you can't, can you see it on his face? The light, well, there's a light. And so I'm going to go ahead and look. They do recommend that you pull down and up so that you can straighten out the canal. This is ear that was infected. How do you feel today, Deacon?
Better.
You feel better? Good. How were you feeling Saturday that night you were crying?
It was really bad.
You were? And what was hurting on you?
My ear.
Okay, but your ear feels better today. Okay. Look that way.
It tickles.
Oh, mama, sorry. Okay. Thank you. As I mentioned earlier, it does come with a thing that shows you what a normal eardrum should look like, one with the ear infection looks like, a perforated one, as well as ear tubes. And my son's ear does not look normal. It still does look like it has like some pus in it and slightly infected, not overly infected. I've seen much worse on my older son, but I do feel like he's on the mend. So I'll just monitor it, and I'll contact back my the nurse that I've been speaking with since he's been ill, and let her know that I looked at it, and just let her know what's going on. And of course I would recommend you do the same. Of course, this doesn't take the place of a doctor or a visit or whatever, but you should know what's best for your kids. So that was my first time using the Otoscope from Dr. Mom. It says catch ear infections early, and I say it was pretty easy to use, and you really can see in there like detail, and I think it's well worth it. We bought ours on Amazon. I'm sure there's several other places you can buy it. The price point, it was around $25. I believe it was a little less, but $20 to $25. And I think it can come in handy when you have, little ones who are prone to ear infections, and even, we could use this to look in their throat or up their noses. And so I think this will definitely be and will be a worthwhile purchase for our family. And so if you're looking to buy one of these because you have a little person who's prone to ear infections, or whoever in your life, because it does work for adults as well, I would recommend it. It's not that big of an investment, but it could give you peace of mind. I give it 2 thumbs up. And that's Yolanda from Saying It Their Way. Bye, guys.